Thank you so much. And now we have Dr. Gitahi. Thank you.
Correct. Distinguished colleagues, Honorable Minister, my sister, Dr. Chiponda Kadondo, MP, Minister of Health, I thank you for your leadership, for Malawi's leadership, for your government's leadership in this agenda. And I think that Malawi must be congratulated for being in the forefront of presenting its own evidence and supporting this agenda of health nexus with climate change. I won't speak for too long. I will just state a few points here. The first thing to say is that health has truly been the orphan of climate change conversations. And that has been discussed by both Mithika and my brothers Mithika and Elia. And this has been despite the fact that it is probably what is going to show the largest impact when global warming actually continues to increase. It is health that will be the face of climate change. It is people's lives that are going to be the face of climate change. It is deaths of families. It is people who will not be able to develop and to participate in socio-economic development of their countries because of climate change. And we know very well that despite the fact that Africa contributes very little, there is no discount to the consequences. Whereas our contribution is less than 4%, there will be no discount of 96% to the consequences. The consequences will be severe as they will be elsewhere. And I think we've experienced this, Malawi, to say the least, and also many other countries, including mine in Kenya, and many other countries, especially the ones that are the small countries, island countries, where their water tables are changing, water is getting salinated, and therefore they're going to have major changes in their health approaches, and also the impact on the health of the people. Of course, across the continent, we know that we have significant premature death. This premature death is related to maternal health, child health, is related to infectious diseases. We have seen firsthand, even as Amref Health Africa, as we work in 35 countries, that this landscape is changing, whereas we are making gains on maternal mortality, on child mortality, on infectious diseases. COVID, which was, we think, and we are convinced that could have been a climate-related change, and also the changes we are seeing in the country are taking away the gain that we have made, and therefore it's going to get worse. And therefore, as has been said before, there is no doubt that the biggest impact of global warming is actually going to be on people's health. In the face of these escalating challenges that are going to challenge the health system significantly, I think that the health system will have two major challenges in the next 5 to 10 years. One will be the climate crisis, the global warming, and the next will be non-communicable diseases. And the two are related and intertwined. In the face of these challenges, we must therefore urgently recognize and address the profound interconnection between climate change and health. And we must not see health participants in the climate change conversation as a side conversation, but health conversations are central in the climate change, both as a contributor and as a beneficiary of the climate negotiations. Let me just say that this is not going to be easy. In my own experience, in our own experience, this is the first time we have tried health incorporated in the negotiations, in the discussions. There are still discussions, even at the Africa Climate Action Summit, on whether to have health as a negotiation item or not. This is 2023, the evidence is clear, but we see that there is still pockets of resistance. So I want to mention to this meeting, this workshop, that let us not assume that because we truly believe in this that others do believe it. We don't want to be the echo chamber or the choir. We want everyone to ensure that actually they engage health in the climate change conversation, not climate change and then health people talking on the side. It's not going to be easy. My own experience in trying to get health central to the Africa Climate Summit action has shown me that we cannot assume that people understand the key challenges that the health sector is facing, including getting the ministers of health to be included in the cabinet conversations in their own countries on climate change. beyond just the ministries of environment and climate. And therefore, it is now clear to us, and to me specifically, that unless we work together through this workshop, this regional meeting, through the working with the Africa Group of Negotiators, who I'm really glad are here, Honorable Minister, through getting this agenda, the heads of state assembly and the Africa Union, and this is something we are bringing to the chair of the Africa COVID-19 Commission, President Ramaphosa, to see whether he can take to the Africa Union Assembly in February, that we need to make it a high political agenda, not country by country, but as an entire continent. Because as we've said, we don't have a 96% discount of the consequences, even as we contribute only 4%. So working together on the Africa common position is actually the most important thing we can do, because that gives the heads of state a position of the Africa Union to hold on to, and ensuring that this is being streamed into UNFCCC. This is critical, and therefore I'm glad that this meeting is happening. But I want to ask this meeting, as we move forward to the Africa Climate Action Summit, to the Africa Climate Week, to the COP28, to looking forward to declarations that are Africa or resolutions at the Africa Union, it is important for us to reflect on investables. We have engaged with the COP28 presidency, and some of the conversations we've had are about what are the investable asks for the health sector in the climate negotiation, because that's the approach. We will do advocacy, yes, and we are doing advocacy, yes, and we made major wins on advocacy, yes, but what are the investables? Is it early warning systems? Is it disease surveillance? Is it converting health system to renewable energy? What are the investables that we are going to take to COP28 for the negotiators to negotiate? This is important, and those investables will be funded both by domestic resources, but also the loss and damage and all these other funds, the climate funds that are actually available on the table that Mithika was discussing. So I would urge us to grasp on the investables as we do this, and as we look forward to the Africa meeting. Honorable Minister, I would like to extend a personal invitation to you, because we have now found space in the Africa Climate Action Summit to host a one-hour ministerial meeting, and obviously along that to have an engagement of the ministers of health, and hopefully to make recommendations that could be considered in the negotiations in the final declaration of the Africa Climate Action Summit. I wish to thank all our partners that are making this possible. Most importantly, our financial Welcome Trust, but also all the ones we are working with, APIDEP, PACJA, WHO in its leadership on ensuring that this agenda is on the table and negotiating for this day that now we have at COP28 in Dubai. Indeed, for us at AMREF, it's not a choice, because working on sustainable health systems in Africa, climate change is going to be the biggest disruptor of the health system sustainability in the continent. So for us, it's not a choice. In our strategy, this is embedded in enabling primary healthcare that's people-led and community-led, people-centered and community-led. And people-centered means all the issues around humanity and people's lives and livelihoods, but also ensuring we address social determinants of health. And one of these is going to be the changes that happen in people's lives because of global warming. Therefore, as I conclude, is to thank the government of Malawi, thank my sister, the minister, and I hope to see you in Nairobi on 3rd of September. And indeed, let us all embrace the fact that health is the human face of climate change. I thank you all and have great deliberations, and I look forward to the outcome.